Is it Tharian? Is that how you pronounce it?
Tharian.
Tharian.
Tharian. Yeah. I think whatever you
Tharian.
say. Tharian. Tharian is my second name.
Tharian.
Tharian.
Okay,
Tharian.
got it. Hello and welcome everyone to Ask Your Doctor. This is an informative health session that is sponsored by My American Doctor. My American Doctor is a group of highly trained and experienced individuals that represent all specialties and provide second opinions throughout the entire country. We are not here to give individual health advice or treatment plans, but to just give kind of a general overview of certain conditions. If you still have any questions or need further clarification, you can definitely get in touch with us. We do encourage the live audience to ask questions. We will answer those here live. Or you can visit us at our website at myamericandoctor.com. And you can also give us a call at 914 to book a second opinion consultation with one of our doctors or specialists. Today, we have the honor of speaking with Dr. Benjamin Tharian, a globally recognized expert in gastroenterology and hepatology. Dr. Tharian is known for his work in advanced endoscopic procedures and has trained in practice across India, the UK, Australia, and the United States. With over 100 peer-reviewed publications and numerous international contributions, he brings a wealth of experience in managing complex digestive and liver disorders. Thank you so much for joining us today, Doctor. How are you doing today?
Not too bad. Thank you so much, Ariana. Good morning, everyone, and thanks for tuning in. How are you?
Good, good. Thanks for having me. I'm excited for our conversation today.
Let's get
Yes.
started.
Yes, let's get started. So first, I'd like to kind of start off by understanding fatty liver disease. It seems to be becomingly kind of alarming in India, very common in India, even among those who do not consume alcohol. So could you help us understand what fatty liver disease is and why is it now becoming seen so frequently?
Thanks, Ariana, for that question. I think it's a very relevant topic in this modern day. You're absolutely right. Fatty liver disease is alarmingly common all over the world, including India. And it's not just in people who drink alcohol. So it's a increasingly growing public health concern in India, for sure. So just to explain in simple terms, fatty liver disease means deposition of excess fat within the liver cells. A small amount of fat within the liver is normal. But when there is too much of the fat deposition within the liver cells, what happens is this causes damage of the liver cells and inflammation. Inflammation leads to scarring. The concerning problem, the main concern about fatty liver disease is that most people who have this are not even they do not even realize that they have this condition until it's too advanced.
Mhm.
So just to briefly talk about fatty liver, there are two types of fatty liver disease. So fatty liver traditionally was believed to be from alcohol, which is called alcohol-related fatty liver disease, and non-alcohol fatty liver disease, or NAFLD, NAFLD, non-alcohol fatty liver disease. So what is considered as a standard alcohol beverage is around 14 grams of alcohol. So someone who drinks in excess of 50 grams of alcohol per day in women, or men who consume more than 60 grams of alcohol daily and have liver disease or fatty liver disease, you would consider them as alcohol related fatty liver disease.
Mhm.
Whereas if you're consuming less than 20 grams per day in women, or men consuming less than 30 grams per day and developing fatty liver disease, then you call them non-alcoholic fatty liver disease, or NAFLD. Does it answer your question?
Yes, yes. Thank you for putting it in very easy terms for us. So yeah, we talk about traditionally these liver issues were associated with alcohol. But as you just mentioned, we are hearing a lot about these non-alcoholic fatty liver disease. Why is this happening?
So there are several theories that are proposed.
Mhm.
What is believed is that the rise in the fatty liver disease from both alcohol-related fatty liver disease and NAFLD or non-alcohol-related fatty liver disease is due to changes in lifestyle, the modern lifestyle, modern day diseases. So like poor diet, lack of exercise, stress. I'm sure we all are stressed. We are all stressed. Even on a Saturday
Yeah.
morning, we are stressed.
Yes.
Metabolic issues like diabetes and obesity, all of them contribute. Insulin resistance. Insulin is the hormone that is produced by your pancreas that controls your glucose levels in the body. Insulin resistance is the key that leads to hepatic steatosis. Steatosis means fat deposition within the liver, and that ultimately leads to steatohepatitis. That means inflammation of the liver.
Mhm.
So this is considered as a systemic disease, which is disguised as just a liver issue. So what happens, as I mentioned earlier, is when there is excess of sugar or simple sugar, excess of sugar in your system, you get sugar spikes, which leads to release of insulin. So insulin spikes, and a lot of insulin spikes make the fat cells resistant. And they will be dumping all the fat into the liver and leads to an overload of fat within the liver. And when there's overload of fat within the liver, there's release of inflammatory molecules, which ultimately cause the systemic issues or associated with this condition. So there is another hypothesis that there may be a second hit hypothesis where an oxidative injury is actually necessary to actually cause inflammation or the necro-inflammatory process component of the NASH. NASH is non-alcoholic steatohepatitis. So in the entire spectrum of fatty liver, you start with steatosis. Steatosis means just deposition of fat within the liver cells. Then the fat deposition leads to irritation of the liver cells and necroinflammation. So there is irritation and inflammation of the liver, which is called steatohepatitis, which is described as NASH, non-alcoholic steatohepatitis. Whenever there is inflammation, just like when you pour acid on your hand, you get burns and you get scar tissue. The inflammation in the liver leads to healing, and the body heals by fibrosis or scar tissue formation. And excess of scar tissue leads to cirrhosis. And ultimately, this cirrhosis leads to compensated cirrhosis, which that means the body puts up with this cirrhotic liver for a long time. Then it decompensates, and then you get liver failure. And a certain percentage of patients with NASH evolve into liver cancer, which is called hepatocellular carcinoma or hepatoma.
Okay. Yeah, so we talk about that kind of progression. It starts with that inflammation and then the scar tissue. Are these something that we see like signs and symptoms for? Like, what are some early signs and symptoms for fatty liver disease that people should not ignore?
So, as mentioned earlier, the problem area now with this disease called fatty liver disease is we don't know about fat deposition in the liver. We'll never find out about fat deposition unless you look for it. Yes, unlike someone who's got hepatitis, we always hear about hepatitis.
Yeah.
Unlike somebody with hepatitis, when you get jaundiced and you notice the yellowing of the eye, by the time this happens in someone who has NASH or fatty liver disease, it's often advanced.
Okay.
Even cirrhosis. For example, yesterday I had a patient in my clinic who was referred by a hematologist who had been looking after her for a long time. She's a 60-year-old lady who has been seen by a hematologist for a while and then got referred to the clinic. And the reason the hematologist was seeing this patient was for low platelets, which is one of the components in your blood. Low platelets. And unfortunately, what we found was the reason for her low platelets is advanced fatty liver disease that has led to cirrhosis and portal hypertension. That means cirrhosis that has been there for a long time, and your spleen enlarges and starts eating up the cells, and your platelet count goes down. So often it could be missed by even physicians. So mainly the symptoms are so very vague, and symptoms happen very late.
Okay. So these are something that we would have to come in and like be screened for beforehand before like seeing these kind of like symptoms and things manifest before it's too late. So this is fatty liver disease is something we need to come in and get screened for. Is that correct?
Absolutely. There's no screening program as such, but definitely something that should be considered. And both the public and the physician community should have very low index of suspicion for this. And
Hmm.
if they find it, they should understand that this is not something that's completely benign or should be ignored, but something that could potentially progress to even needing liver transplantation. Make sense?
Okay. Yeah, that makes sense. Yeah. So are there like any genetic kind of factors, or is this specifically like lifestyle patterns, diet habits that are making fatty liver disease more common? Definitely in like India compared to these other countries.
So you're absolutely right. The
Hmm.
lifestyle changes, as we discussed earlier, is one of the major problems or major reasons behind fatty liver disease. So, and it's more common in the urban and semi-urban population because of the higher consumption of refined sugars like white rice and sugar, then unhealthy fats, processed food. We all enjoy our processed food, but
Yes,
unfortunately,
we
it's not good for the liver.
do. Yeah.
High calorie, Indian food is high calorie Indian staple food. That's not
Yeah.
healthy for the, not good for the liver. And we are all sedentary. We are not running around doing stuff. We are all sitting in front of a computer and doing stuff. So
Yeah.
sedentary habits with little physical activity and easy access to junk food and sweetened drinks, all these things will definitely contribute to fatty liver disease and is believed to be one of the main reasons why fatty liver disease is increasing all over the world, including India.
Hmm. Yes.
So the answer to your specific question as to whether there are other genetic reasons, yes, fatty liver disease, especially the non-alcoholic fatty liver disease or NAFLD, is linked to several unhealthy metabolic conditions
Hmm.
like increase in belly fat or abdominal obesity, insulin resistance, high blood pressure, that's hypertension.
Hmm.
Women with polycystic ovarian disease is also considered in the same umbrella as the metabolic syndrome,
Okay.
syndrome X, and high cholesterol levels, hyperlipidemia. So all these things can put you at a higher risk of developing non-alcoholic fatty liver disease. And yes, one of the things that is explained as the reason why people develop fatty liver disease is genetic. Some people may be predisposed to fatty liver disease genetically. It's not the
Hmm.
main reason, but again, we haven't identified several genes. We probably know about maybe 4 genes, and and these genes may predispose you to a higher risk of developing fatty liver disease or non-alcoholic fatty liver disease.
Hmm.
For example, one of the genes that is very well known is called P for Peter, N, P for Peter, L for Leo, A for Alpha 3, PNPLA3. It's a long name. I'm not going to say that.
Yes.
Read it out. I'll struggle. So it is supposed to be due to a mutation in a couple of amino acids. That means one amino acid is changed, replaced by another amino acid. And this mutation is reasonably common in Hispanics and also in Asians. And this will put you at a higher risk of fatty liver disease.
Mm.
And there are generations of families who develop fatty liver disease and complications of fatty liver disease, even without any other associated risk factors. So
Mhm.
yes, the answer to your specific question is there are just some genes that can be blamed or that have been found to put you at a higher risk of developing fatty liver disease, even without any other metabolic risk factor.
Mhm.
Then at the same time, there are some genes which will lower your risk of cirrhosis, regardless of the cause of liver disease. There are some genes,
Mhm.
especially the gene called CIDEB gene, that can theoretically that can lower the risk of cirrhosis or scarring of the liver from any etiology, any cause that causes liver damage.
Mhm. And those are genes that we have already within us that have been like passed down or
Absolutely. So,
okay.
these have been picked up in families who develop fatty liver disease without any other risk factors. So they have looked at
Okay.
their genetic makeup and the genome-wide analysis have been done, and that's how they found that these specific individuals or specific families do have these mutations, which either reduce your risk of cirrhosis or increase your risk of fatty liver disease. And we
Okay.
know that not everybody with fatty liver disease is obese or overweight.
Mhm.
And we also know that about 25%, about 1 in 4 of the patients with fatty liver disease are lean. So it's called lean NAFLD. So lean
Okay.
non-alcoholic fatty liver disease. And if you just look at the general population, about 10% of the general population can have lean NAFLD. Whereas if you just include the entire group of people with NAFLD or non-alcoholic fatty liver disease, 25% of them will have lean NAFLD.
Okay.
Compared to, so this 10% of the general population compared to around 30 to 35% of the general population having NAFLD. So about 30% of the general population, about 1 in 3 of the adults will have NAFLD.
Okay. That's
It's a shocking number,
interesting.
isn't it?
That is very shocking. That's very interesting. So to kind of wrap that up, there are genetic factors and certain things that put us at risk, but honestly, it is that role of like processed foods and sedentary lifestyles that should be kind of looked at before it becomes an issue. So we're also seeing reports about a high rise in liver cancer cases in India. Is there like a direct link association between untreated fatty liver disease and that liver cancer that we're seeing?
So yes, as we discussed earlier, NAFLD leads to, it is part of a spectrum. So non-alcoholic fatty liver disease is part of a spectrum, starting from steatosis, which is just fat deposition within the liver, to steatohepatitis, which is inflammation caused by the fat. That is called NASH, or nowadays it's called the new terminology. And everybody likes to find new names, new
Yeah.
names. So it's been coined, a new term has been coined in 2020 called MAFLD, or metabolic dysfunction associated fatty liver disease. So MAFLD, or sometimes some people call it MASLD. That is metabolic dysfunction associated steatotic liver disease. Everything makes you sound pretty posh. So
Yes, right.
MASH or MASH, it all stands for the same thing. So it's a different terminology, that's all. So yes, steatosis progresses to MASH or NASH, which is steatohepatitis. And as I mentioned earlier, inflammation heals by the process of scar tissue formation, which is fibrosis. And excess of fibrosis leads to cirrhosis. So cirrhosis means a combination of fibrosis or scarred liver with some lot of regeneration of some nodules. So that's how the liver becomes nodular or lumpy bumpy. So that's a cirrhotic liver. And cirrhosis, we know that cirrhosis is a risk factor for hepatoma or liver cancer. And we previously had a large percentage of patients with cirrhosis who we will never find an etiology for. So we think that we don't know. We have done all the tests, but we are still not able to point our fingers or pinpoint a specific etiology for the cirrhosis. So what has been realized over the last couple of decades is a vast majority of patients who were previously labeled as cryptogenic cirrhosis. Cryptogenic cirrhosis means cirrhosis with no cause. Are actually fatty liver disease that progress to cirrhosis, which has never been picked up because it's a reasonably new diagnosis, and we were not aware that fatty liver could actually progress to cirrhosis and liver cancer. So yes, the answer to your specific question is yes, at least a large percentage of patients with hepatoma or liver cancer is from progression from fatty liver disease, and that's becoming one of the major causes of liver cancer all over the world, not just in India, all over the world.
Mhm, mhm. That's very interesting. I've never heard that before. So yeah, we talk about those liver conditions being diagnosed a lot later, all over the world. So would you say that is a lack of awareness and a lack of screening that is causing that?
So I think there's a combination of things. Not only in India, all over the world, there's several reasons. Just like the patient that I saw yesterday, there are several reasons why we often diagnose it late. So number one, it could be lack of awareness amongst the public, right? So lack of awareness amongst the public, and also lack of awareness amongst the physician community. So the physician community, the primary care, the general practitioners, your primary health centers in India, primary health centers, secondary health centers, the community health centers, all those people, the Panchayat health center, the general hospitals, and all that kind of place, medical college, everybody at all levels should be aware of the fatty liver disease, the spectrum of fatty liver disease, what are the implications, how does it progress, what is the natural course of fatty liver disease, and we should have low index of suspicion for treating them or at least
Mhm.
following them up to make sure that these are picked up on time before it progresses into cancer. And we could potentially prevent it from progressing to cancer and or liver failure or needing some major problem, including treatment, including liver transplantation. So we could potentially prevent that. So yes, the lack of awareness is extremely important. Second thing in India would be probably limited access to preventative care. Unlike the Western countries, there's limited awareness, limited access to preventative care, especially in the rural community or in the poor socioeconomic areas. That might be an issue. And routine health checks, right? Like the screening that we do in the US is not that popular, not that common in India, not yet, but I'm sure it's rapidly catching up, which is a change for the good.
Yeah, so we continue this conversation about it's not only people who drink alcohol that are getting these liver problems. So how can we change that perception, especially in these more rural or kind of less educated populations?
So I think there are a few things that we should think about. I think there are a lot of myths about this amongst the public. Several myths
Hmm.
about this amongst the community, as well as amongst the even among the physician community. So one of the things that people often believe is, at least they will think that whenever someone says they got a liver disease, the first thing that comes to mind, maybe he's drinking too much. So we
Yeah,
have to understand that alcohol is not the primary reason for a liver disease. Yes, excess of alcohol can cause liver disease. I'm not supporting people drinking too much alcohol, but I'm not
yeah,
promoting that either. But
yeah.
the fact is, there are other things which could be often missed, so overlooked.
Hmm.
So fatty liver disease is an important cause of liver disease, including cirrhosis and liver failure. So that's something that everybody should be aware of. Number two, we think, or the community thinks, or the population, general population thinks that fatty liver disease occurs only in fat people or in overweight people. That's also wrong. As I mentioned earlier, about 25% of patients with non-alcoholic fatty liver disease, they're lean. So lean non-alcoholic fatty liver disease. And again, it is believed that a vast majority of these patients may have some genetic mutations that probably is not diagnosed, that is contributing to that. But it's not a small percentage, it's a large percentage there, right? 25% of patients with non-alcoholic fatty liver disease are lean.
Hmm.
Third thing that I would mention is it's not about just taking excess of fat. So we think that it's taking excess of fat which is causing fatty liver disease. No, it's a combination of multiple things as we discussed. It's a change in diet, change in lifestyle, sedentary lifestyle, stress, other metabolic syndromes like hypertension, diabetes, so many associated conditions, and so on.
Yeah.
Final thing which I wanted to mention here about the myth is we think a lot of patients here, even here in the US, the patients come in and ask us, can I take this medicine? Can I take this supplement over the counter? I heard that saw some advertisement saying that it's good.
Yeah.
So many of these health products, in fact, vast majority of these health products or so-called health products and supplements have got no evidence behind it.
Yeah.
There's no robust evidence behind it, and it's more of a uh, liability to the medical community and to the public than
Yeah.
it's going to favor or support the liver health. So milk thistle, for example, very popular, very common.
I've heard of
Everybody,
that one.
they find it from somewhere. They find it, buy it over
Yeah.
eBay. They get it somehow. India, I heard that in India, and I see that in the US as well. So there is no evidence that it actually supports liver failure or cirrhosis or fatty liver. There's definitely no robust evidence. Glutathione, another thing, very common, very popular, very common in the wellness groups.
Yeah.
So again, there's very little evidence that it helps the liver. Carnitine, then things like Ayurveda, Siddha, and all that kind of stuff. It's a more of a healthcare liability than an asset to the community.
Hmm.
So I would say that the main things that we can do to change this perception is number one, educating it, just like videos like this and chances, opportunities that everyone should make use of is listening to videos like this and trying to realize and trying to educate your family, your friends, and your community that yes, fatty liver disease is something that exists. It's not just a myth. It's not just a thing for the textbooks, but it is a real problem. Number two, we have to educate schools at
Yeah.
schools, because childhood obesity is what often progresses to adult obesity.
Yep.
So as I mentioned earlier, the occurrence of prevalence of fatty liver disease in adults is about 33, 34%, whereas in children it's about 36%. So this fatty liver disease happens in children too. And again, the sad thing is about 70%, 68 to 70% of patients, children with fatty liver disease is from obesity, from being overweight. So
Yeah.
yes, we do need to educate not only the adults, even at schools. Even in the
Yeah.
schools, we should be educating them, the teachers, the children, everybody, parents should all be educated about this.
Yeah.
Then healthcare workers should be educated, the local clinic should be made aware of this, and we should have more community engagement to explain the liver health. Not just this, they should have more things in the news channels in India on a regular basis, just to educate people that this is something that we can prevent, and this is
Yeah.
something that's becoming an epidemic in India.
Yeah. That is so interesting about children having fatty liver disease. I mean, we just kind of associate it with like, people who are a little bit older, or again, going back to that alcohol. And it's just so interesting to see that this is taking over even the younger population. That's so interesting to me. Wow.
Unfortunate, interesting at the same time, it's unfortunate too. We
Yeah.
sometimes see people with children with cirrhosis. It's terrible.
Yeah, that's wow. So what are the best ways then to screen for this fatty liver disease early? Are there ways or things that you guys do to go about that, kind of detecting it early?
So thanks for asking that question. In the US, in the Western population, we have things like colonoscopy for bowel cancer screening. I'm talking about my
Hmm.
world. There is
Hmm.
screening in every specialty, but in the GI, in the gastroenterology world, we do screening colonoscopies. But there's no screening program as such for screening for fatty liver.
Okay.
So there is no robust program for screening for fatty liver even in the West. But I think we need to know, everybody needs to know that these are things that can be picked up early. And we are also aware, as we discussed earlier, the vast majority of patients with fatty liver are asymptomatic until it is very advanced.
Yeah.
So we need to pick up this condition early on to prevent it from progressing. So the best way to screen for this is by doing a blood test. So for example, when they come for your health wellness check, you can do a blood test and look at the simple liver test. If the liver enzymes are abnormal, that might be a sign that there's something going on with the liver, and then you starts from there. The next step is often getting an ultrasound. So
Mhm.
ultrasound of the liver will show fat deposition within the liver. The liver test may not always be abnormal with fat deposition within the liver. The liver test will often become abnormal only when the fat deposition leads to inflammation and necro-inflammatory changes and causes steatohepatitis. Even the
Mhm.
enzyme levels, even in patients with steatohepatitis, may not always be abnormal. So it's not a very sensitive indicator. So that's the reason why there are several, the smart hepatologists have found, I should just say the conflict, disclose my conflict that I'm not a hepatologist. I'm a gastroenterologist and a hepatologist, but my major interest is interventional gastroenterology. So the
Okay.
transplant hepatologists and the hepatology societies basically have found several evidence-based parameters, simple non-invasive markers to pick up fatty liver disease. So blood tests, looking at the liver test, and things like FIB score, FIB4, FIB score, and there are numbers that have been all strongly evidence-based things like FIB score. If it is less than 1.3, it tells it that even though they have fatty liver, the chance of they haven't progressed to fibrosis or scarring or cirrhosis. There are other scores which include APRI score, APRI, then FAST score, FAST, then ELF score. Uh, for example, the APRI score, which has been there for quite a long time now, APRI score less than 0.45 will almost exclude fibrosis or cirrhosis.
Hmm.
On the other side, a liver stiffness measurement using what's called a fibroscan. A fibroscan is a outpatient procedure that is done. It's a non-invasive procedure. You just put some shock waves, sound waves through the liver, and you look at
Okay.
the elasticity of the liver, how quickly it is reflected by the liver. So depending on how elastic the liver is or how scarred the liver is, the rate of it bouncing back to the transducer is affected. So based on that, the FibroScan will give us a fibrosis score and a CAP score, which is a fat score. CAP score basically reflects how much fat is in the present in the liver. That is one of the gold standards now. In fact, the gold standard would still be considered as a liver biopsy. But liver biopsy is an invasive procedure. Yes, we do consider liver biopsy in someone who has got a very high, someone who we really suspect, but the other tests have not confirmed it. We do liver biopsy, again, an outpatient procedure, but slightly invasive procedure. It's done either by radiologists or by interventional gastroenterologists. We do it at the time of endoscopy, where you're doing endoscopy for something else. We can also take a sample from the liver using endoscopic ultrasound. So the liver biopsy, the pathologist looks under the microscope, and if more than 5% of the liver cells within the slide contain fat, then you make a diagnosis of metabolic dysfunction associated fatty liver disease, or MASLD or NAFLD. That's how you make the diagnosis. And looking for inflammation specifically on the inflammatory cells on the microscope, under the microscope, you can make confirm the diagnosis of NASH. And you can also confirm the diagnosis of cirrhosis by looking at the biopsies. But often, as I said earlier, we don't need a liver tissue to confirm this diagnosis. Again, coming to the same topic, while we are looking for fatty liver disease, we should also exclude other things that can cause fatty liver disease. So fatty liver disease can be caused by medications, for example. Tamoxifen, the treatment for breast cancer, tamoxifen can cause fatty liver disease. And amiodarone. Amiodarone is a medicine that's given for irregular hearts or for arrhythmias, atrial fibrillation. So amiodarone can cause that. Steroids can cause that. Methotrexate, which is a treatment for rheumatoid arthritis and inflammatory bowel disease. Methotrexate can cause that. So there are several things other than just metabolic syndrome which can cause fat deposition within the liver. So we should look for all those things as well, just like we would normally screen any patient with liver disease. Does that answer your question?
It does, yeah. So I think my most anticipated question of the day is, can fatty liver then be reversed? Is that
so? Yes,
possible?
I think again, very important thing that we should it should be advertised. Like that's one of the reasons why fatty liver disease, the diagnosis is important, because just with simple things like lifestyle changes, dietary changes, and losing about 10% of your body weight. If you aim to lose 10% of your body weight, not too much, you can try 3 to 5% is sufficient, most often, to prevent it from progressing. But if you lose 10% of your body weight, that's often sufficient to even reverse the changes of even fibrosis. So there are studies which have shown that even cirrhosis can be reversed, but small percentage of patients with cirrhosis or advanced fibrosis can be reversed. But at least we can prevent the fatty liver disease from progressing to NASH or cirrhosis, or definitely progressing to liver cancer and liver failure. So dietary changes, exercise, regular exercise. So at least 30 minutes of brisk walking, at least 5 days a week, and yoga, very popular in India. Avoiding saturated fat, and refined sugars, taking a more balanced diet like fruits and vegetables, more fruits and vegetables, reducing the portion in your plate. And in addition to this, try to cut down the overall calorie intake by about 30%. And so now, coming to medical interventions, there are medicines that can be given for fatty liver disease. So again, we don't want to add more medicines because you already have a list of 25 different medicines that you're taking. So you don't want to overburden patients. But at some point that you have to decide that you may need some medications to prevent the progression or to reverse the fatty liver disease. So the medications that have been tried include vitamin E, pioglitazone, which is a medicine that's given for diabetes. So people with diabetes and fatty liver could be considered on pioglitazone or vitamin E. Statins, which is used for treatment of cholesterol, hyperlipidemia. Statins can actually improve the liver condition, but it's not recommended in someone with liver failure. But until you have liver failure, statins are supposed to be useful. It reduces the fat burden in the liver and the damage. Another thing which is very common in India, commonly used in or popular in India, is recently approved in India, is saroglitazone. Saroglitazone is a thing that is approved in medication that's approved in India for NASH or fatty liver disease. Then in the US, we have what's called resmetirom or Resdifra. Resdifra is a new medicine that's available in the US for treatment of fatty liver disease. And the GLP analogs, the very popular Ozempic and Manjaro and all those things.
Yes.
In US, it's extremely popular. Everybody wants to be on Manjaro and fatty liver disease. It seems like that's a new trend. Everybody wants to get
Yeah.
it somehow and wants the insurance to approve it. Yes, it is very useful. It's very useful. It causes significant weight loss,
Yeah.
And as we discussed, once you reduce your insulin resistance and you change your metabolic dysfunction, you are able to alter the course of the fatty liver disease. So it's extremely useful for preventing or reducing the progression and even reversing fatty liver disease. And I know
Hmm.
that the GLP analogs like Ozempic and Manjaro have been approved in India in the last year. Within the last year, it has definitely been approved and very popular. Very useful
Yeah.
treatment, very useful medication. But obviously, every medicine comes with side effects. So you need to be advised the medication, and you need to be monitored for any complications too. And final thing would be more aggressive interventions like surgery. So if
Hmm.
someone has got fatty liver disease and has tried everything, lifestyle changes, medications, dietary changes, everything, and exercise, and still not losing weight, and the BMI often is more than 35%, 35, BMI is often more than 35, you could recommend bariatric surgery. Bariatric surgery means weight loss surgery. Very
Hmm.
effective surgeries. The bariatric procedures can be done endoscopically, which is what I do, or you can do it surgically, which is open bariatric surgery, or robotically, it could be done robotically, which is robotic bariatric surgery is also becoming increasingly popular in India. So
Hmm.
endoscopic bariatric procedures is called endobariatrics. So the interventional gastroenterologist like myself, we can go in and put balloons in your stomach, big balloons filled up with water or saline, and that occupies the stomach, a large portion of the stomach, and makes you feel full. So when your stomach is heavy and full, there's not much space in the stomach to fill up, and the stomach, there are receptors that send signals to your brain telling you that you're full, you can't eat anymore. And if you try to eat more, you'll start throwing up. So you learn that you should not be eating too much.
Yeah.
That is one thing, putting balloons in the stomach. Second thing is we can stitch up the stomach. Endoscopically, it's called endoscopic sleeve gastroplasty. So I've been doing this for the last few years now, endoscopic sleeve gastroplasty. In India, endoscopic sleeve gastroplasty has been available probably over the last 3 to 4 years. Very effective, and it causes significant weight loss of up to 20 to 25% excess body weight loss, or even more. And it's an outpatient procedure, often done as an outpatient procedure. You get it done and you can go home.
Okay. Wow.
So weight loss procedure, weight loss surgery done endoscopically. Then you go to the proper bariatric surgery, which would be where you're changing the actual anatomy of the stomach by either doing a commonly used ones are sleeve gastrectomy, where you remove a portion of the stomach and make it into a banana shape. For the ESG or the endoscopic sleeve gastroplasty, we stitch it up and we make it into the banana shape without cutting it out. But in patients who have got higher BMI and who are not proper candidates, you can consider doing the sleeve gastroplasty, or they may prefer going for that. The other one is gastric bypass, which can cause up to
Mhm.
40% weight loss, significant weight loss. We see
Wow.
patients who say that they've lost 300 pounds and 400 pounds weight loss
That's
after
crazy.
gastric bypass. So very useful surgery. We always worry about the complications of surgery. So bariatric surgery has got about 0.2% risk of complications like death, uh, whereas that risk goes up to about around 0.6 to 1% when you have fatty liver disease. When you have cirrhosis, it goes up to but when you have decompensated cirrhosis, once your liver starts failing, the mortality, that means death from a bariatric surgery, goes up to about 16 to 20%. So definitely don't go for bariatric surgery once you have decompensated liver disease. But until you decompensate, you can do less invasive procedures like endoscopic bariatrics or endobariatrics, or you can go for even the surgical procedures. And
Hmm.
there is very rare, very minimal contraindication or very minimal reason. It's very rare that a endoscopic procedure is contraindicated in someone with fatty liver disease. Even patients who are sick, who are not surgical candidates, could be considered for endoscopic weight loss procedures.
Yeah. Yeah.
I think that is a long explanation I gave you for your simple question.
That is
I hope I
okay.
didn't
We
complicate
appreciate it.
complicated.
Yeah. Yeah. So those procedures you kind of talked about are going to be a little bit more like invasive and a little bit kind of further down the road, depending on where the patient is. So, do you recommend most of the time, like, do you give your patients medicine when they come in and they find out they have fatty liver, or is it more of like a recommended kind of lifestyle change, diet change, come back, see how things have gone? What is the most kind of common things that you tell your patients?
So, the again, useful question, very useful question. Thank you for that. I think the main thing to remember is what stage within the spectrum of liver disease, fatty liver disease are we? Our
Hmm.
aim is to prevent NASH and definitely prevent cirrhosis and definitely prevent progression to liver cancer, right?
Yeah.
So if you're early on within the spectrum with fatty liver disease or even NASH, we could potentially reverse it. And even small percentage of patients with cirrhosis could be reversed. So our aim is to reverse it early on. So always we aim for lifestyle changes and we bring
Hmm.
them back in 2 or 3 months and see how things are, or maybe earlier on, depending on what stage they are in. So lifestyle changes, dietary changes, exercise, and all that kind of stuff. And we see whether things are improving. We look at the fibroscan. Fibroscan, as I said, is a non-invasive procedure. We have it in the clinic. We just put the shock again and see whether the number, it's not a shock, it's just a sound wave. So
Yeah.
we put the shock wave through the liver and look at the fibroscan values, the CAP score and the fibrosis scores, and see if it is improving. If it is improving, we know that we are on track. So we can continue to improve, continue to monitor.
Yeah.
Whereas the other thing to remember is with most of these lifestyle changes, probably only about 10% of the patients, unfortunately, are able to achieve the targets or able to sustain the results.
Hmm.
So when patients have, for example, if they have NASH or MASH, which is a new term, metabolic dysfunction associated steatohepatitis. So when they have more advanced liver disease within the spectrum, then comes the medications. Then comes the role for the medications, the newer ones, which I mentioned earlier. For example, the resmetirom or the resmetirom in the US, and vitamin E, pioglitazone, all those things that I mentioned earlier on. So
Yeah.
those things will be considered when you have progressed. And yes, our goal would be to avoid invasive procedures whenever we can. But when someone is not improving or is not able, and the liver tests are getting worse, and the stage of liver disease is getting worse, then of course we will advise or recommend more invasive procedures, starting always with the non-invasive lifestyle measures and progressing that way.
Okay, awesome. Yeah. So to kind of wrap all of this up here, then what would be your top three pieces of advice to every just household, Indian household, when it comes to protecting liver health, especially in this current era where we see just fast food, long working hours, lots of stress? What would be your top three pieces of advice?
So I think the three key takeaways from this session would be: number one, remember that there is something called fatty liver disease. So it does
Mhm.
exist. It's often asymptomatic. So you don't have symptoms until it's too late. So get your annual checkup, just like it's done in the Western countries. Get your annual checkup. If you have an ability to do that, do go for the annual checkup to your primary care or to your gastroenterologist. Primary care should be able to most often do most of these things. Get your annual checkup, including some blood tests for the liver and the routine blood tests, and also get an ultrasound of the liver, non-invasive test. Especially if you have other things, risk factors like diabetes, obesity, or a family history of liver disease or cirrhosis. Regardless of the cause of cirrhosis, if you have a family history of cirrhosis, go for an ultrasound. Simple, non-invasive test. That's number one. Number two, lifestyle, dietary changes. So, including myself. So,
Mhm.
I tell my patients, do what I say, but don't do what I do.
Yeah, right.
So, so change your plate size. So, half the plate with vegetables and fruits, 1/4 with whole grains, 1/4 of proteins. Cut down on the fried snacks and sugar and all the white rice and the all those things, the hot dogs and all that kind of stuff. Cut it down.
Good stuff.
Third
Yeah.
thing, the good stuff, the so-called good stuff. We have to cut it down. And finally, very important is move your body, exercise. So brisk walking, brisk exercise, running, jogging, or any exercise, whether it's cardio or otherwise resistance exercises, do it for at least 30 minutes, 5 days a week. and it can reduce fatty liver dramatically, even if your weight has not gone down. So independent of the weight loss, there will be improvement in your fatty liver disease by just following these changes. So remember, as a final thought from me, remember your liver is a silent worker. So it is working hard for you, So it's your aim to protect it, right? So you cannot live without the liver. You cannot have a failed liver and live. You cannot live without a liver. And liver failure will end up needing liver transplantation. That's the only thing that's going to save you, keep you alive. So in the West and in India, fatty liver disease progressing to liver cancer and liver failure is becoming one of the major reasons for liver transplantation. So your liver, it works silently in the background. It will not complain until things are really bad, really serious. That's not a good thing. The liver should start complaining early, but unfortunately it does not. So we have to accept it. You have to look for it. You have to watch out for it. But the good news, I want to end in a good news. The good news, as we said again and again, over and over again, is fatty liver is something that can be diagnosed easily, non-invasively most of the times. And the treatment also can be, most of the times it's non-invasive treatments, less interventions needed. So fatty liver can even be reversed, definitely be prevented and can be even reversed. All it needs is awareness and small, consistent changes. So for you viewers and for myself, from my end, I'm wishing all of you a very happy and blessed liver-friendly weekend.
Yes.
Thank you so much, Irina. Thank you so much.
Thank
And
you
thank you
so
everyone for
much,
tuning in.
Doctor. Of course, I appreciate you for being here today. I think we had an amazing conversation. I appreciate everything that you shared with us. Definitely some key takeaways that hope the audience heard and definitely will kind of implement into their lives. So we appreciate everything that you shared with us today. And I hope you just continue to have success in all of your work.
Thank you so much. Good luck. Thank you.
Thank you. Have a good one.
You too.
Bye.
Bye-bye.
Bye.